Welcome to the 7th episode of Arogyam Kata. Today, we will be talking about from specialist to super specialist. A new era begins. To discuss this, we have with us Dr. Vispi Jokhi, an orthopedic surgeon from JJ Hospital with more than 40 years of experience. Dr. Jokhi also pursued his master's from Tata Institute of Social Sciences and specializes in joint replacement, trauma, and hand surgery. He also mentors MS Orthopaedic students and is currently the CEO of Masina Hospital, Mumbai. Let us welcome Dr. Vispi Jokhi.
Welcome to 7th episode of Arogyam Kata. Today we'll be talking on a very interesting topic, death of specialist, birth of super specialist. I remember when we were young or school-going children, about 60 or 65 years back, there used to be a family physician who used to be a part of family. He knew everything about us or everything about our family. All family functions he was the invitee. In fact, I have seen many invitation cards of a marriage wherein the doctor's name also used to appear as an invitee. I don't know, Dr. Vispi, I see that community doesn't exist.
Yes.
So that was the era of general practitioners.
Right. So basically, before I start, I would actually not even call this a debate between specialists and super specialists, but I would call it a debate between generalists, specialists, and super specialists. So by the very definition, when you say general practitioner, it meant general. And then the broad specialties started coming in, and those also initially were named general surgery, general medicine.
Correct.
And then they went region-wise, like, okay, there are certain branches. For the eye, you went ophthalmologist. For the bones, you had orthopedic surgeon. And obviously, the first thing, gynecology became a specialized subject, and gynaec and obstetrics came in. So generally, those broad specialties, and that is the way the division occurred in medical education also. So basically, after you become an MBBS, you become a general specialist, and after general specialist, you become a super specialist. Now, with every such step, slowly, the relevance of the generalist and the specialist started becoming lesser and lesser. And with time and all the constraints and the way the fast pace of life in the city evolved, the people started going more directly to specialists rather than going to generalists. And the general physician which you talked about, became virtually a dying pride. And yet, nostalgia would have people thinking, yeah, I wish we had someone generalist to guide us. So that is the way things are. That's my take on the general practitioners.
But don't you think it confuses the patients? Because earlier we used to know that there is a single window who would then guide us to a particular specialist. But today, there are so many super specialist branches that I don't know if something is wrong with me. I don't know where to go. In such scenario, how would you handle it as a patient? See, you are talking as a medical professional point of view. But as a patient on the other side, I find it extremely difficult. Like earlier there used to be a physician. Now you have a chest physician, you have so many specialists in that. Now, I really don't know where to go when I have a cough or something. Now, how do you handle this kind of situation, or what would you advise patients in such situation?
Yes, I do think that there is still a role for generalists to be there to guide the patients. However, the marketing and the way hospitals are running this and promoting the specialties, people tend to go directly to specialties. For example, if someone has a knee pain, he says, why should I go to a GP? I'll directly go and get it done from a TKR specialist. Or someone has a bad cough or something, and he knows about it from people that, well, I had a bad cough, my GP couldn't solve it, I had to go to a specialist, and then everything starts driving from there. So the patient's awareness and the explosion of technology and knowledge has led to the patients also seeking the specialist directly. And then also this kind of suspicion that they've been having in medical practice, whether the general practitioners are actually referring for other considerations other than the real considerations, that trust factor has started also going down. And that's why this whole ecosystem has gradually changed, where the patients are directly seeking care from specialists and super specialists, and slowly discarding the general physicians. And in fact, the MD physicians also and the general surgeons are slowly becoming more and more irrelevant.
Correct.
So it is becoming worse than before.
Correct.
So as an orthopedic surgeon also, like when my own training, if I look at it, I was a general orthopedic surgeon. And as things evolved, then I also had to sort of, send patients who I thought required specialized procedures to another person. Initially, many orthopedic surgeons or many specialists used to keep these patients to themselves, refer it to a super specialist. But there used to be a conflict in that, in the sense that patients used to feel that if the generalist is not, general specialty person is not having such a big role to play, then why is he actually holding on to the patient? So that's the take that I would say.
Mm-hmm.
However, the flip side also is there that many are self-styled super specialists.
Correct.
So there are some people who really don't have a qualification to be super specialists, but they put on their name that I am a super specialist. So the patients are not aware of that, and they get taken in by that, and sometimes that also creates a problem. So as a specialist, I would advise the patients to be wary of this, check the credentials of the super specialist, make sure that they know whom they are going to, make their inquiries and then...
But doctor, what happens is, now if I have to check the credentials of my treating doctor, all what I can check is the degrees that he mentions on his letterhead or outside his cabin or whatever.
Yeah.
I mean, I have specially seen this as a diabetologist, a physician practicing as a diabetologist, as a chest physician, or a new thing was as an emergency medicine has emerged out. And it's so confusing. Probably what you say is correct, that it's a demand and supply. That patients were looking at speciality more than the generalistic. So
Right.
probably it's the patients also partly to be blamed for this present scenario.
So basically, my take on this is that there are patients who are always in awe of a doctor. They are not, there's a kind of a power asymmetry when a patient goes to a doctor, because they believe that he knows best and I am someone who don't know. But now I think the time has come for patients to question the doctors and ask them, can you tell me what your qualification or experience? Supposing someone says, I am a knee replacement specialist, it's the patient's right to ask that, how many knees have you done? What is your experience for this? I have a complex problem. I have a complex
Comorbidity.
comorbidity. What could you do? All those things need to be asked. And I think it's time for patients to ask. And in our country, one of the problems I think is there are no clinical audits, outcome audits in the real sense. See, there is nobody who is regulating and finding out whether the results are good or not. And that problem can be solved to a large extent if you have national registries, like they have in some countries, especially in the UK NHS system, where all the results of surgeries of all kinds, procedures of all kinds are published in a national registry. So there is a database which the patient can refer to and find out what the results of the particular procedure is. I think the time has come for India to also evolve in that direction.
So that means, when I study something and go to a doctor and starts asking questions, they say, oh, you are a Google patient. And medical fraternity absolutely hates Google patients.
Absolutely.
Okay. Now, in such scenario, as I said, as a patient, probably this is the worst time that you have a problem and you don't know who will solve the problem.
Yes.
So anyway, now, is it advantageous to go to a specialist or super specialist, or super specialist via specialist?
I think there is a merit in taking the advice of a generalist or a specialist, but then there is a problem in that also. Very often the generalist or the specialist is not updated in his knowledge enough to know that there is a procedure or super specialist available for something. and therefore he may give an advice that don't do a particular procedure. I'll give you many examples. Like I can look at my own practice. Like the days when we used to examine the patients and diagnose clinical problems, say in the hip, knee, or something, and then we used to advise conservative treatment based on our examination findings. We were not tending to investigate also. Now we investigate more. We find something which is there. I can talk of shoulder. You find a tear of a kind of rotator cuff tear, which is like commonly done. All those rotator cuff tears were ultimately stiff shoulders, were treated by physiotherapy, and they used to become quite well with time. But you go to a specialist, he will say, I want to repair that tear. I want to put it back into position. So that is an issue which I need to address. So the super specialist tends to sometimes advise more surgery because he has the armamentarium. He has it's like, I call if a person has a sophisticated knife or a weapon, he is bound to use it, rather than the person who doesn't have the weapon. So he will give a balanced view and say whether it's required or not. So that also is something which the patient has to be wary of. So it is a generalist who can advise this and guide the patient on to decide whether he should really go for the complex and advanced procedure which has been advised or which has been envisaged.
So for a proper balance, I think specialists, super specialists are required in the society. And the patients, like earlier, they used to go to a general family physician. I think should now go to a specialist and then directed to super specialist. What's your take on this?
The point is well taken, but what is happening is that with this change in the scenario, even when the students who are taking the medical education, they are changing their perspective. Mm-hmm. Like this is very surprising, which I have also noticed now recently. The students are planning their super specialty way before they finish their specialty training.
Okay.
So I have seen situations where the specialists who are, when they're training itself, are actually not wanting to get trained in the broad specialty. I'll give an example. I had a colleague of mine who was talking to me. We were conducting an MS Orthopaedic exam, and he said that, well, sir, can you imagine? I told my second year resident that you would do a spine surgery independently, do a discectomy, you'll learn.
Good.
So he said, sir, I'm not going to do this in future. Why do I learn? But that is a bad thing. Ultimately, I think a general specialist must get trained in all the varieties of surgeries, must know something before he can opine. So that is also another problem which I can see which is happening. People are planning fellowships way from the beginning itself. They just want to do their broad specialty, run abroad, get a fellowship, come back. They come back with a lot of training, but they have lost the touch of the general doctor. And the general doctor is definitely required.
Now, the culture today is large large hospitals than nursing homes. I see in Bombay, last year at least about 40 nursing homes closed their shutters.
Right.
So it's the way is probably a hospital 100 bed plus. Now, these hospitals will have specialists, super specialists, but their hospitality also is very great. So they are very expensive. So the cost of treatment from few thousand rupees have gone into a few lakh of rupees.
Agreed.
Now I think that's the future.
Yeah, that is the future, but I think the medical insurance should take care of that, and that is how I think now the costs of healthcare in hospitals are virtually dictated by the insurance companies. So basically now it is coming to a situation where rather than pricing a product or pricing a service based on what the market should support or what the pocket would support, it is priced what the insurance company would support. And that is the same price which is given to even the patients who do out-of-pocket expenses, trying to push them into insurance. So all that is fine, but I think at the end of the day, we have come to a system where we are getting increasingly controlled by government,
by third parties.
So that is one issue which comes out. And as you also mentioned that yes, there are the super specialty hospitals have to come up because the technology and infrastructure these small nursing homes cannot afford. And if you cannot afford, you cannot put that kind of investment and that kind of equipment which requires this specialized procedure to be performed properly.
Are we heading towards left shoulder specialist hospital, right shoulder specialist hospital? I mean, this is a sarcastic statement, but the way things are, I mean, we are becoming not only super, probably a couple of years down the line, super duper specialist probably will be a in thing to come.
Yeah, you are saying that, but actually I can see it already happening. For example, there are people who treat leukemia, so the specialist of acute myeloid leukemia, the specialist of chronic myeloid leukemia. Cancer surgeries literally become now region specific. Nobody, there's no general cancer oncosurgeon. Most of them are region specific. I am a breast specialist. I am a GI, I am a hepatobiliary specialist. I am an endocrine laparoscopic surgeon. So all this is the fragmentation which is occurring more and more. Now, what happens in that scenario? I tell you, a patient comes for one ailment. He gets into the hospital, is diagnosed for multiple ailments. Multiple specialists come and start treating him. And then it becomes like the story of the elephant and the six blind men. So everybody is, looking at each of his own angles. He is looking at one region, the other is looking at the other region. The doctors are coming, seeing the patients at their own times because they are also running around from one place to another. The RMOs are also confused with the orders given. And in the end, something gets lost. So it's like a team with star players, but with no captain. So the generalist has to become the captain, according to me. If the generalist even plays the role of a captain and coordinates all this treatment properly, then I think we will be able to strike a balance. But I think for that also a model of hospitals where full-time doctors dedicated in the hospital working towards that goal, where everything is integrated properly, is something which we should aim at. And that is not the reality today, at least in the city of Mumbai. But we should evolve to that, and I think that is the way forward. So that will be a fine kind of balance where the generalists, the super specialists complement each other, and we achieve better outcomes in a very good team holistic approach.
Thanks for summarizing it nicely, and let's hope in days to come we see more patient-centric hospitals. And thank you for your expert advice and expert discussion.
Mr. Gadgil, it was indeed a pleasure talking to you, and I wish your YouTube channel Arogya Katta success and more followers in the future. Thank you very much. I enjoyed this program very much.
Thank you for coming to Arogyam.
Thank you very much.
Doctor, I'll ask you some rapid fire round questions.
Sure.
Just answer briefly.
Sure.
The number of super specialists is increasing in the medical field.
Absolutely.
Super specialists are required to have more training than regular specialists.
Yeah, more and more training, definitely more.
The super specialist focuses on narrower areas of medicine than a regular specialist.
Yes, and unfortunately, that is an unfortunate occurrence, but true.
Super specialists can provide better outcomes for complex medical conditions.
Mixed answer, sometimes yes, most often, but sometimes can be disastrous.
It's more expensive to see a super specialist compared to general specialist.
In the short term, more expensive, and long term, cheaper, because then you have better outcomes.
Super specialists are available in all the hospitals.
No, not at all. It's available only in few hospitals.
Super specialists often work in larger, more advanced medical centers.
Yes, true.
The rise of super specialists has reduced the demand of general specialists.
True, definitely true.
It's harder to become a super specialist than a regular specialist.
Now people directly want to become super specialists. That's the reason why it has become like that.
Patients need referral from general practitioner to see a super specialist.
Not necessary any longer.
Patients need referral from specialist to see super specialist.
No, nowadays people are going directly. Ideally, they should have a generalist referring.
Thank you very much.
Thank you.
If you liked the video, please subscribe to our YouTube channel, Arogyam Katta, where we bring you insightful interviews with doctors from various specialties. Stay tuned for expert advice and valuable health information.